Hi everyone, this is Silver Hill and welcome back to my channel. My name is Kevin, and in this video we're going to talk about how to deal and the whole idea of dealing with either aging parents or an aged parent that you are sort of caring for remotely, and the problems associated with that. Well, to start off, my dad passed away about 4 years ago, and so you can see other videos about that and the different struggles and things we went through with that. But in this video, it's more about my mom. My mom has dementia, and she has been living in a nursing home almost the entire time since my dad died. She was quite fortunate actually to get in a nursing home. We weren't able to, so soon, only a matter of weeks or so, or months, a couple months after my dad passed away. But one of the things about this, and it does put a lot of stress on a person. I live about, driving on the highway, it's a 5-hour round trip to get down to where she lives. That includes, a little lunch break and washroom break if you need it. Perhaps if you really floored it on a good day, good weather, everything goes in your favor, maybe 2 hours, so a 4-hour round trip. But basically, it's not an easy thing to do, and certain things will occur that'll put stress on a person that's mostly psychological, and it's because we feel our limitations to be able to help the person as they're aging and to be there with them. Now, in my mom's case, she is living in her hometown. We couldn't look after her. That's sort of a given because of the layout of our house, because it's actually dangerous for mom, and it wasn't a comfortable setting for her to be living at home, and she needed extra care because she is a dementia patient and she needs someone there for her pretty much 24/7. And if you've dealt with dementia patients in any regard, you know that even in early stages, you think that you can trust the person to look after themselves or care for themselves if you're not around, but that's not necessarily the case. It doesn't take long for them to get into trouble. It is quite a thing. I know, thinking about it, it doesn't make me all that happy about how we do this cycle, and we try to butter it up. Some people try to make things seem like, well, you're in your golden years and you're on your last journey, and you'll have a better afterlife or something. And then other people sort of say, well, these are the good times, or you don't have to worry so much. But really, I think, kind of face it, overall for most people, this time in life kind of sucks. Although I'm not saying you can't have your good days as well. I do believe it's about days and moments, experiences. For mom example, this sort of getting on a little bit of a tangent here, so I hope I don't lose you. She really enjoys someone's company, and she really enjoys doing things and being with people. But a few hours later or a day later, she doesn't remember that it happened. So she can't replay those good feelings, those good memories. It's sort of, it always has to be, the more of those good moments you get, then the better she's gonna be. So overall, we were fortunate just to get her in a home where she could have her medications looked after and everything. And also, because she's in her hometown, there was it's a very small community that she was born in. She never lived her whole life there. But she has a sister that lives there who's actually 90 years old and still lives in her own home. She just turned 90, and the home is not too far from, if you're healthy, you could just walk it in a few minutes. But there have been times where the staff will bring my mom up to visit my aunt, and they can enjoy an afternoon together. But my aunt is admittedly getting too old to be able to care for mom if she should fall or choke. She has swallowing issues. She has to take medication for that. So you have this intricate situation that's happening, and you wish as the child, and I'm actually mom's power of attorney. My brother, he lives in the States. He lives actually further away. It's it's more than a day trip for him to get here. And so it kind of leaves most of the responsibility up to me, that I'm the oldest. Not that it has to be that way, but it is stressful. And you guys know that if you've gone through the same thing, it's that sense of you wish you could be there. I'll just tell you what happened last Thursday, and this has happened. Mom has fallen. Now this is the third time this year she has fallen. She has a walker. So we're at that stage now. Is it going to be time for the wheelchair? And like my brother says, the wheelchair means more UTIs, more urinary tract infections probably. This is what they discovered. Anyways, her recent fall, just a couple days ago, they decided, they have a nurse there in the home, in the senior care home, or a couple nurses, and they decided because of her fall that this time they better, and they had before once, this time they better get the ambulance. And so the ambulance has to come, the ambulance has to transport her to a nearest hospital that could take someone in at the time, because our health institution or whatever is stretched to the max. And so sometimes you may not even know which hospital you're going to, depending on which one is available. So she had to go, and like my aunt couldn't go with her or anything like that because she's pretty much chair bound, although my aunt can walk around with a walker as well. But as I was saying, we're at that stage now of like, is it time for a wheelchair? Is it time for a better walker? And you have these issues where, you want to be there, and you want to be there for your parent. You want to hold their hands. You want to make them feel cared for, and that that they would know that you're actually present with them. So, yeah, in this video, just going to talk about this, and I have a couple solutions, and maybe they're self-consolation, but maybe they're good as well, that will help you. One is that, Mom turned out, just to let you know, she turned out okay. They were going to keep her in overnight, but an ambulance did become available, and she fell just before supper time, and then they took her in, and they looked her all over, gave her an x-ray to make sure anything wasn't broken, and they did discover she had a urinary tract infection. So they're treating her for that, and she was supposed to stay overnight, but an ambulance became available, as I said, and she got to go back to her home. So I was kind of glad for that, because being a dementia patient, she can be confused easily and disoriented and feel lost. And then, that puts extra stress on them. Now, when you're 5 hours away, you're the only tool you have is really your telephone. That's about it. And so you're calling, like I did that evening. I got the call. When you see the call and you're kind of living with this, it's sort of the sword that hangs over you all the time, that you feel that anytime the phone could ring and you see it's the nurse's number, and you don't know if it's going to be, hey, can she get her vaccines? Or, hey, she just fell and broke her hip, or, hey, she had a heart attack, or whatever. You never really know. And so you have to live with that stress. But here's one of the ways I think that I've been trying to deal with that. And number one is, just to backtrack a little bit, I got a call from them, and they said from the home, and when they got the ambulance, they said just give her a couple hours and then maybe call emergency. And so I did. I called the emergency, later in the evening, in the middle of the evening, and she had arrived, and then they kept me up to date on her situation. And then I don't remember if I called emergency, but I waited till the next morning to call her sister, because I didn't really want her feeling that same. She feels the same thing. She's 90 years old. She feels it's her only sister left. The rest of her siblings have all died off, and so Mom and my aunt are the only two left. So yeah, she feels the same thing, even though she's a stone's throw away from where my mom lives. But yeah, so maybe distance isn't the biggest issue sometimes. So I did call the next morning. I had the phone next to me and made sure the ringer was up and everything through the night, or the buzzer, whatever. And just in case they called and they needed something from me. But it does feel like your hands are behind your back, and this is your mom who you know loved and cared for you your whole life. And in my case, she was a good mother. Maybe in your case, it was a different story. She was always a very good-natured person. She wasn't narcissistic. She wasn't manipulative. She wasn't a mom like that. And she still is. Even when I heard, they told me that when the ambulance came, she was trying to make the ambulance drivers and everyone else feel comfortable and at ease about her situation, and telling jokes and things. So she's quite an amazing woman that way. But I wish I could be there. But I think the number one thing is I have to trust, to some degree, I have to trust the nursing staff and the professionals that are there. It doesn't mean I just let them completely go without any advice or help or whatever. But it's kind of like you have to trust to some degree that they're going to do their job. Now, it is still good to keep in touch, because when I called the hospital that night, I wanted to mention she fell just before. I mentioned, well, I just want you to know that she fell just before supper. So she could be getting hungry. And the nurse said, yeah, I just gave her a sandwich. Now, I didn't ask what kind of sandwich, but that's kind of important, actually, because I said to her, well, my mom has an issue with swallowing, and so she can't really do a lot of this, dry bread or crackers and stuff like that, because it'll cause her to choke. And apparently, when I told that to the nurse back at the home, they said, yeah, every time she goes, she gets a sheet sent with them. I don't know if it's a physical sheet or a digital or whatever, that explains all her medications and her physical struggles. So what's funny is when I talked to the nurse in emergency, she said, oh yeah, I see that. So she hadn't looked at that sheet before she gave Mom the sandwich. So there could have been more issues. So you see, you can't totally leave it up to them, because they're busy, and yeah, they should be doing their job, but they are busy and things fall through the cracks. So my one word of advice, I guess, is you got to find this balance somewhere where you're not completely stressed out all the time about when your mom could fall or something bad's going to happen. Because you got your own life to live. You got to sleep. You got the next day. You got to have your own sleep to function. You're no good if you're up all night and you end up having to travel for some reason. We have all her funeral arrangements, and her, looking after her remains is all taken care of and prepaid. So that takes a lot of stress off too. If you have that done, you know that you don't have to be right there in an instant. But yes, could be, sometimes people don't just go out like a light switch off and on. Sometimes they need, care and company. But I would say trusting the staff to some degree, doing your best. Just say to yourself, you're doing your best on the phone. You can't get on the highway driving in bad weather, or sometimes just being on the highway is dangerous anyway. But for an event that may not become an event, if you know what I'm saying. And so far she's back to normal, doing good, and now we're meaning myself actually, am going to try to talk to the nurse before she gets back in. Like there's nurses there on staff, but then there's a doctor. Yes, that's more that comes around, like a circuit doctor or whatever. And I think her visit is this Wednesday, and I'm going to try to call, leave a message for her and say, is it time for mom to be in a wheelchair? Because like everyone says, my brother says it, my wife says it, and I hate to use the word they because we're all human, but if they fall and break a hip, or their hip breaks and they fall, that's usually in the story. That's what the general understanding seems to be. So that's my one tip for dealing with this. Perhaps you have more tips. Dealing with the anxiety that can come with worrying about aging parents, and you're not able to just... There's also an added stress there. It may not be in your case if you have an aging parent, but other relatives, for example, my aunt, who is, I think one of the reasons she lived to be 90 is she's kind of the opposite to my mom in some ways. She's not easygoing. She's a strong personality, and she knows what she wants, and she feels that people should give her what she wants when she asks for it. So my aunt can be very strong that way, and it puts extra stress on me. In the past, if anything happened, my father, he had like 3 heart attacks and a couple strokes before, over the years before he died at 87 years old from a stroke. So, even in that case, it was kind of like, you have to be here. You have to be here. Like, it doesn't matter if it's a dead of winter or it's a hailstorm or you're 5 hours away. She has this she puts this pressure on me, unfortunately. And also, like, if I don't call all the time, like, I call her and I keep her up to date on mom as soon as anything happens. And like, I'll say to my wife, she expects me to, not my wife, but my aunt seems to expect me to call her more than my parents used to when they were both living at their home. I wouldn't hear from my parents for at least every 2 weeks, or vice versa. I call them. But my aunt seems to think, and she'll say, like, under her breath, yeah, you'll never call. But I do. But so there's this stress of, that I have to let go too. There's a lot of things, I think, with dealing with aging parents and their relatives and their expectations, but knowing what you're capable of and telling yourself you don't want to be on the highway. Like my aunt will say, oh, so-and-so, that's no big a deal. Seriously, she'll say, oh, my neighbor's 95 years old and she throws in 6 cord of wood every winter, and and so-and-so 75 and they drive to another province, and it's just on a drop of a hat. It's like, but you have to tell yourself you're not that person. You have your own assessment of your own health, your own body, what you're capable of doing, and that's okay. It's trying to win in this situation and say, well, I'm going to explain to them or prove to them that I'm doing the right thing. It's right for you if you've rationally thought through, I can't drive down there every time my mom takes a fall because it's so many hours away, or I'm tied up, or whatever, or I can't stay up all night waiting for the phone to ring. You're the one that knows best what you can and can't do, and it's not up to others to judge that. So trust in the staff. I think that's all I have to say in this one. Trust in them, trust in the doctors to some extent. Do what you can. If you're only relying on your telephone, your smartphone, whatever, to contact these people, that's all you can do. I think that's all I have for now for some advice of dealing with aging parents. It is difficult, but try to look for those good moments and recreate those good moments and memories you had with them, even in their old age, when you get down to visit them. Like my brother, he only gets home for a year. He only gets home once a year. And it's a lot because he lives in another country. And he works full time, and he's not retired yet. And yeah, we all have our situations, and this is what it is. So, so that's what all I have to say. So just write down in the comments if you guys have any suggestions for dealing with this. If this sounds familiar to you, let me know. It'd be great for us all to hear your suggestions. And you have a good one, and we'll see you in the next video.